Good day, everyone! I am Torregosa
My name is Tupa, BSN Level 2 Block B student.
of Visayas State University. And for this video, we will be talking about the autobiography of the drug testosterone enanthate.
So, for example, I am the testosterone enanthate. So, of course, my generic name is testosterone enanthate, and my brand names are Delatestril Andro LA, Andropository, Cipionat, Cypoprime, Depandro, Durathate, Everone, Testostype, Testostroval, Testrin, Testro LA, and Cyosted. And my chemical name is testosterone 17 beta heptanoate.
For its drug classification, testosterone enanthate's therapeutic classification is for hormonal stimulant. This is used in men or boys that lack this hormone, testosterone, and used for such as delayed puberty, impotence, and other hormonal imbalances. For its pharmacologic classification, it is used for androgen replacement therapy. And for its pregnancy category, it is X, means it studies in both human and animals, shows a high risk fetal abnormalities.
So, my mechanism of action. My effect in humans and other vertebrates occur by way of two main mechanisms: by activation of the androgen receptor directly or as DHT, and by conversion of estradiol and activation of certain estrogen receptors. The free testosterone is transported into the cytoplasm of target tissue cells, where it can bind to the androgen receptor or can be reduced to 5-alpha dihydrotestosterone DHT by the cytoplasmic enzyme 5-alpha reductase. And DHT binds to the same androgen receptor even more strongly than T, so that its androgenic potency is about 2.5 times that of the T. The T receptor or DHT receptor complex undergoes a structural change that allows it to move into the cell nucleus, and binding are called hormone response elements or RHE, hormone response elements, and influence transcriptional activity of certain genes producing androgen effects. Such activities are useful as endogenous androgens like testosterone and dihydrotestosterone are responsible for the normal growth and development of the male sex organs, and for maintenance of secondary sex characteristics. These effects include the growth and maturation of the prostate, seminal vesicles, penis, and also the scrotum. The development of male hair distribution, such as facial, pubic, chest, and axillary hair, laryngeal enlargement, vocal cord thickening, and alterations in body musculature and fat distribution. Male hypogonadism, a clinical syndrome resulting from insufficient secretion of testosterone, has two main etiologies. Primary hypogonadism is caused by defects of the gonads such as Klinefelter syndrome or Leydig cell aplasia, whereas secondary hypogonadism is the failure of the hypothalamus or pituitary to produce sufficient gonadotrophins, FSH, and luteinizing hormone.
For its pharmacokinetics, we have the absorption, the distribution, the metabolism, and the excretion. For its absorption, the pharmacokinetic profile of testosterone enanthate was studied in a regime of multiple dosing, and the testosterone level was reported to present a Cmax above 1,200 nanograms per deciliter, and after 24 hours of the last dose. The concentration decreased sequentially until it reached 600 nanogram per deciliter after 1 week. The pharmacokinetic profile of testosterone enanthate presented differences depending on the administered dose, in which the Tmax was shifted to a range of 36 to 48 hours. The plasma testosterone level plateaued below the therapeutic range after 3 to 4 weeks. These reports show that a different formulation of testosterone enanthate and testosterone cypionate generates a different profile, and thus they are not therapeutically equivalent. For the distribution of this drug, the volume of this distribution following intravenous administration of testosterone is of approximately 1 liter per kilogram. For its metabolism, to start its activity, testosterone enanthate has to be processed by enzymes in the bloodstream. These enzymes will catalyze the molecule at the ester location of moiety. The processing time depends on the size of the ester, and thus, in testosterone enanthate is registered to present a longer processing time. Once processed in this manner, the testosterone enanthate molecule is metabolized to a various 17 ketosteroids through two different pathways. Subsequently, the major active metabolites are estradiol and DHTD. Testosterone is metabolized to DHT by steroid 5-alpha reductase in skin, liver, and urogenital tract. In reproductive tissues, DHT is further metabolized to androstenediol. For its excretion, about 90% of a dose of testosterone given intramuscularly is excreted in the urine as glucuronic and sulfuric acid conjugates of testosterone, and it's metabolized. About 6% of a dose is excreted in the feces, mostly in the conjugated form. The inactivation of testosterone occurs primarily in the liver.
So my indications. So I am classified as an AAS because I am both a synthetic derivative of testosterone and a testosterone prodrug, meaning that I stimulate the body to produce testosterone on its own. With that being said, I have a stronger androgenic effect and only moderate anabolic effect. So also indicated for replacement therapy in conditions associated with a deficiency or absence of endogenous testosterone. So primary hypogonadism, congenital or acquired is a testicular failure due to cryptochordism, bilateral torsion, orchitis, or absence of endogenous testosterone. So that is one of the examples. So hypogonadotrophic hypogonadism, congenital or still acquired, gonadotropin or luteinizing hormone releasing hormone deficiency or pituitary hypothalamic injury from tumors, trauma, or radiation. Appropriate adrenal, cortical, and thyroid hormone replacement therapy are still necessary, however, and are actually of primary importance. So, my safety and efficacy in men with age-related hypogonadism, also referred to as late-onset hypogonadism, have not been established. In delayed puberty, I may be used to stimulate puberty in carefully selected males with clearly delayed puberty. These patients usually have a familial pattern of delayed puberty that is secondary to a pathological disorder. Puberty is expected to occur spontaneously at a relatively late date. Brief treatment with Conservative doses may occasionally be justified in these patients if they do not respond to psychological support. The potential adverse effect of bone maturation should be discussed with the patient and parents prior to androgen administration. An X-ray of the on-hand and wrist determined bone age should be obtained every 6 months to assess the effect of treatment on the epiphyseal centers. Testosterone levels in men can often decline steeply after the age of 50, leading to a condition known as andropause, in which vigor and sexual desire are affected. Older men with symptoms of andropause, including fatigue and low libido, will often benefit from TRT. So, I can also be used for hormone therapy in transgender men to treat delayed puberty in boys and to manage inoperable metastatic breast cancer. It is a breast cancer that has spread in postmenopausal women. The I am also sometimes used controversially as an anti-aging therapy in older men. In females, metastatic mammary cancer I may be used secondarily in women with advancing inoperable metastatic or skeletal mammary cancer who are 1 to 5 years post-menopausal. Primary goals of therapy in these women include ablation of the ovaries. So other methods of counteracting uh, counter counteracting estrogen activity are adrenalectomy, hypophyseectomy, and or anti-estrogen therapy. This treatment has also been used in premenopausal women with breast cancer who have benefited from oophorectomy and are considered to have a hormone responsive tumor. Judgment concerning androgen therapy should be made by an oncologist with expertise in this field.
These are the contraindications of the drug testosterone enanthate. There are conditions in which this drug should not be used in any circumstances. This includes the use of testosterone in men with untreated prostate cancer or breast cancer in pregnant women. The drug should also be avoided if you are allergic to sesame oil or any components of the drug. For prostate cancer risk, the prostate gland is an organ in men whose role is to secrete prostate fluid, one of the components of semen. The gland is dependent on androgens to function and will decrease the production of prostate fluid if the androgen level is low. In tandem with this decrease is an increase of prostate gland enlargement, a condition referred to a benign prostatic hyperplasia or BPH. The enlargement not only obstructs the flow of the urine, it can also lead to bladder stones and reduce kidney functions. Testosterone replacement therapy is known to improve urinary symptoms in men with BPH. Moreover, it appears to do so without increasing the risk of prostate cancer. The same may not be true for men diagnosed with prostate malignancy. While the association between testosterone use and prostate cancer remains highly controversial, there have been reports, mostly anecdotal, that testosterone use in older men with untreated prostate cancer led to metastasis. With that being said, a 2012 study from Harvard Medical School concluded that there was no link between disease progression and testosterone use in 13 men with untreated prostate cancer, who were on treatment for an average of 2.5 years. Other studies have reached a similar conclusion. Despite the continued controversy, the FDA strongly advises against the use of testosterone in men with untreated prostate cancer. Even for men without cancer, any elevation in the prostate-specific antigen or PSA test within the first 3 to 6 months of starting testosterone would warrant the cessation of treatment until a complete cancer investigation can be completed. For male breast cancer risk, the evidence supporting the avoidance of testosterone in men with untreated breast cancer is equally uncertain. Although a retrospective study conducted in 2006 suggested an 11% increase in male breast cancer risk over a 10-year period. The mechanism for this association is poorly understood, and many don't believe that it actually exists. For men with untreated breast cancer, the FDA remains adamant that the use of testosterone poses a potential threat and should be avoided without exception. For risk in pregnant women, the use of testosterone enanthate is contraindicated. When administered during pregnancy, testosterone can cause the virilization of a female fetus, a condition known as gestational hyperandrogenism in which male physical characteristics are present in a girl. Some of the symptoms of virilization may be seen at birth, while others may only become apparent during puberty and later in life. They include an enlarged clitoris and external genitals, ovarian cysts even in childhood, excessive body or facial hair, larger bone structure, smaller breast, hair thinning characteristic of male pattern baldness, and deeper voice. The risk of virilism is higher in mothers who themselves are experiencing virilism as a result of testosterone use. Testosterone therapy must be stopped if a pregnancy is suspected, especially during the first trimester while fetal cells are still specializing. If the pregnancy is confirmed, the parents would be advised about the potential hazards to the baby. Testosterone use does not appear to pose any risk to a breastfeeding baby, as the components of the drugs are largely metabolized during they reach the bloodstream, breast milk, or other body fluids. Similarly, testosterone use in men does not pose any risk to a pregnancy, either during conception or gestation.
So my side effects as a substance designed to alter hormone levels, I have both its clear benefits and I also have the risks. The side effects can change from mild to intolerable. The most serious side effects are associated with testosterone abuse, an increasing problem in the United States, which lead the U.S. Food and Drug Administration, also known as the FDA, to change the product warning label in 2016. So, my common side effects, according to the FDA, the most common side effects associated with me, with when you use me, include injection, side pain and swelling, headaches, dizziness, mood changes, depression or anxiety, increased or decreased libido, generalized tingling sensations, oily skin and acne, thinning of hair, and also weight gain. The severity of side effects is typically dose dependent and may be alleviated by reducing the current dosage. So, the adverse reactions. These are the less common but potentially more serious side effects associated with the long-term use or overuse of me when they overuse me. So Some are related to the androgenic effects of the drug, others can affect the heart and liver by alleviating the cholesterol and liver enzyme levels. So you must also call your doctor if you develop any of these following. So this one of these are the male pattern hair loss, male pattern hair growth in women, also known as hirsutism, the male breast enlargement, also known as gynecomastia, deepening of voice in women, menstrual irregularities including amenorrhea, clitoral 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 enlargement, prolonged painful erections in men, also known as priapism. So also the difficulty of urinating or frequent urination at night in men. So and also the severe psychiatric symptoms including major depression, paranoia, or psychosis. Some androgenic effects in women, such as clitoral enlargement and the deepening of the voice, are irreversible once they develop. A low sperm, also known as oligospermia, can impair fertility in men. The excessive use of testosterone can also increase the risk of heart attack, stroke, congestive heart failure, and deep vein thrombosis, also known as DVT, deep vein thrombosis, especially in men. Severe liver injury can also occur, characterized by symptoms of fatigue, abdominal pain, nausea, vomiting, dark urine, and the yellowing of the eyes and skin, also known as jaundice.
These are the nursing responsibilities before administering the drug. First is, a nurse should be certain of the identity of the patient before administering a drug and confirm with the wristbands and ask the patient for their name and date of birth, as well as ensure that the patient is not allergic to the drug. Second is, a nurse should have a clear knowledge of medication to be administered, which is the testosterone enanthate, its medical use, regular dose, reported adverse effects, and any specific contraindications or precautions associated with the drugs to prevent any untoward complications. The third one, the nurse should also be familiar with the treatment plan of the patient and the need for the drug to be administered to the patient and perform a thoroughly physical assessment. To establish baseline data before drug therapy begins, to determine effectiveness of therapy, and to evaluate the occurrence of any adverse effects associated with drug therapy. The fourth one is, the nurse should also consider the dose, the route, and pacing recommended and equate this with their understanding and experience. Fifth, the nurse should also verify the drug's expiry date. And the last one is to arrange for radiographs of the long bones in children to assess for testosterone effects on the growth.
So these are the nursing responsibilities when or during I am taken. So monitor the responses carefully when beginning therapy so that the dose can be adjusted accordingly. Remove an old dermal system before applying a new system to clean dry, and intact skin to ensure accurate administration and decrease risk of toxicity. Also, you have to monitor liver function periodically with long-term therapy and arrange to discontinue the drug at any sign of hepatic dysfunction. Also, provide thorough patient teaching, example measures to avoid adverse effects, warning signs, need for regular evaluation, especially blood pressure, and etc. So, to enhance patient knowledge about drug therapy and to promote compliance with the drug regimen. And also provide safety measures, example, educate lighting, raise side rails, and etc. to prevent injuries. So the administration, when I am administered, should be reported immediately in the patient's notes clearly and accurately, with the nurse signing and printing their name and documenting the date and time I was administered. So there also uh, when after administering me to the client, one of the nursing responsibilities is to monitor the patient response to therapy, example, the onset of puberty, maintenance of main sexual characteristics, uh, the palliation of breast cancer, and etc.
So that is for the drug, autobiography of the drug testosterone enanthate. I hope you learned something and enjoy watching our video together with my partner, Ken Tupa. Thank you for watching and goodbye!